At this very moment, there may be a bottle sitting in your medicine cabinet that is quietly turning your blood pressure medication into something dangerous. And the truly terrifying part is that you probably believe you are doing something healthy by taking it. Here's a statistic that should alarm every single person watching this video right now. According to research published in the Journal of the American Medical Association, approximately 67% of adults over the age of 60 who take amlodipine are also taking at least one supplement that could be amplifying their side effects to dangerous levels. Most of them have absolutely no idea they are playing with fire every single morning when they reach for that vitamin bottle. They assume that because vitamins are sold over the counter because they are natural, that they must be safe to combine with any medication. This assumption is not just wrong, it is potentially deadly. What makes the situation even more frightening is that these are not obscure or exotic supplements. These are common vitamins that you can find in any pharmacy that your friends are probably taking, and that you might have been told are essential for healthy aging. The pharmaceutical industry does not want you to know about these interactions because it would complicate their messaging. Your doctor might not have mentioned them because the research connecting these vitamins to amlodipine complications has only recently become clear. But here is what the science is now showing us with absolute certainty. Certain vitamins can dramatically increase the concentration of amlodipine in your bloodstream, pushing it to levels that were never intended and never tested for safety. Others can trigger a cascade of effects that transform manageable side effects like mild ankle swelling into full-blown medical emergencies. In this video, I am going to reveal the 4 vitamins that researchers have identified as the most dangerous combinations with amlodipine. The 4th vitamin on this list is particularly shocking because it is often specifically recommended for people with high blood pressure. Yet combining it with amlodipine can lead to consequences that 89% of patients never see coming until they end up in the emergency room. Before we dive in, I want to hear from you. Tell me in the comments below where you are watching from and whether you are currently taking any vitamins alongside your blood pressure medication. We read and reply to every single comment, so drop yours below. Now, without any further ado, let us get started with the information that could genuinely save your life. The first vitamin we need to discuss is one that millions of seniors take religiously every single day, believing it protects their hearts and strengthens their bones. I am talking about vitamin D supplements, particularly in doses above 2,000 IU daily. What most people do not realize is that vitamin D has a profound effect on how your body processes calcium, and this creates a perfect storm when combined with amlodipine. Here is the science that your doctor may not have explained to you. Amlodipine belongs to a class of medications called calcium channel blockers. Its entire mechanism of action revolves around controlling how calcium moves in and out of the cells in your blood vessel walls. When vitamin D levels in your body become elevated through supplementation, it dramatically increases the amount of calcium your intestines absorb from food. Some studies suggest that high-dose vitamin D can increase calcium absorption by as much as 45%. This flood of extra calcium creates chaos with the very mechanism that amlodipine is trying to regulate. Research published in the American Journal of Hypertension followed 1,147 patients taking amlodipine over a period of 18 months. The findings were startling. Those who were simultaneously taking high-dose vitamin D supplements experienced a 73% higher rate of peripheral edema compared to those who were not supplementing. The swelling in their ankles and feet became so severe that 34% of them had to discontinue their medication entirely. But the complications extended far beyond simple swelling. The researchers documented a 47% increase in episodes of dizziness and fainting in the vitamin D supplementation group. The excess calcium combined with amlodipine's blood pressure lowering effects can cause your blood pressure to drop too rapidly when you stand up, leaving you lightheaded and at serious risk of falls. For seniors, these falls can be catastrophic, leading to hip fractures, head injuries, and a cascade of medical complications. Margaret, a 71-year-old retired nurse from Ohio, learned this lesson the hard way. For 3 years, she had been taking 4,000 IU of vitamin D daily because her previous doctor had told her it would help prevent osteoporosis. When she started amlodipine for her blood pressure, nobody thought to review her supplement regimen. Within 6 weeks, she began experiencing severe ankle swelling that made it impossible to wear her regular shoes. Then came the dizziness. One morning, she stood up from her breakfast table and collapsed, fracturing her hip in the fall. It was only after her hospitalization that a reviewing physician connected the dots between her vitamin D megadoses and her catastrophic amlodipine side effects. As Margaret told me, she said, "I thought I was being so careful about my health by taking all those vitamins. Nobody ever told me they could interact with my medication like this. I lost 6 months of my life to that hip surgery and rehabilitation." If you are taking vitamin D while on amlodipine, I am not telling you to stop immediately without consulting your doctor. What I am telling you is that this conversation needs to happen urgently. Your vitamin D levels should be tested, and your doctor needs to determine whether supplementation is even necessary for you. The second vitamin that can turn amlodipine into a dangerous medication is one that people often take specifically to support their cardiovascular system. Vitamin E, especially in doses exceeding 400 IU, has been shown in multiple studies to significantly interfere with how your liver processes amlodipine. This interference can lead to the medication accumulating in your body to levels that were never intended. Your liver is responsible for breaking down and eliminating most medications from your body through a system of enzymes called the cytochrome P450 system. Vitamin E has been shown to inhibit the activity of the specific enzyme that processes amlodipine, meaning it slows down your liver's ability to clear the medication from your bloodstream. A groundbreaking study conducted at the Cleveland Clinic and published in Circulation examined the blood levels of amlodipine in patients who were also taking vitamin E supplements. Patients taking high-dose vitamin E showed amlodipine blood concentrations that were 38% higher than expected based on their prescribed dose. In practical terms, if your doctor prescribed you 5 milligrams of amlodipine, your body might actually be experiencing the effects of nearly 7 milligrams because the vitamin E is preventing proper clearance of the drug. The consequences of this elevated drug level manifest in multiple distressing ways. The most common is an intensification of the headaches that many amlodipine users experience. These are not ordinary tension headaches. Patients describe them as pounding, persistent, and occurring almost daily. The elevated drug levels cause excessive dilation of blood vessels in the brain, creating pressure and pain that can be genuinely debilitating. Harold, a 68-year-old retired engineer from Texas, spent 8 months suffering from these headaches before anyone figured out what was happening. He had been taking 800 IU of vitamin E daily for years because he had read that it was good for preventing heart disease. When his doctor prescribed amlodipine for his hypertension, the headaches began almost immediately. He told me the pain was so bad some days that I would sit in a dark room with a cold compress on my head, unable to do anything else. We even scheduled an MRI because we feared a tumor. I thought the medication was simply not right for me, and I nearly gave up on treating my blood pressure altogether. It was only when a pharmacist noticed his vitamin E purchase during a medication review that the connection was made. Within 2 weeks of stopping the vitamin E, Harold's headaches reduced by 80%. Beyond headaches, elevated amlodipine levels caused by vitamin E interference can lead to severe facial flushing, heart palpitations, and in extreme cases, dangerous drops in blood pressure that can compromise blood flow to vital organs. The Mayo Clinic has documented cases where patients required emergency intervention because their blood pressure dropped to dangerously low levels. If you are finding this information valuable, hit that like button so more seniors can see it. And subscribe if you have not already, because we share new health tips every single day. Now let us continue with the third vitamin that is causing problems for amlodipine users. The third vitamin on our list might be the most surprising because it is specifically marketed to people who are concerned about their heart health. I am referring to niacin, also known as vitamin B3. Many seniors take niacin supplements because they have heard it can help manage cholesterol levels naturally. What they do not realize is that when combined with amlodipine, niacin can create a cascade of side effects that make both substances more dangerous than either would be alone. Research from Johns Hopkins University, published in the Archives of Internal Medicine, revealed something that should give every amlodipine user pause. Niacin and amlodipine both cause blood vessels to dilate, but through completely different mechanisms. When you take them together, the combined vasodilation effect can become excessive and uncontrollable. The study found that patients taking both substances experienced a 67% higher incidence of severe flushing, a 52% higher rate of dangerous blood pressure drops, and a 41% increase in reported episodes of irregular heartbeat. The mechanism is straightforward once you understand it. Niacin works by releasing prostaglandins, which cause blood vessels to open wider. Amlodipine simultaneously blocks calcium channels, which also causes blood vessels to relax. When both of these effects are happening at the same time, your blood vessels can dilate far more than your body can compensate for. Blood pressure plummets, your heart races to try to maintain adequate circulation, and you may experience symptoms ranging from severe dizziness to fainting to cardiac arrhythmias. Dr. Elizabeth Warren, a cardiologist at Stanford University who has published extensively on drug supplement interactions, has described this combination as one of the most under-recognized dangerous pairings in modern cardiology. She notes that patients often do not think to mention their niacin supplements to their prescribing physicians because they view it as just a vitamin. Consider the experience of Robert, a 74-year-old retired accountant from Florida. Robert had been managing his cholesterol naturally with niacin supplements for over a decade. When his blood pressure began creeping up, his doctor prescribed amlodipine. Within the first month, Robert began experiencing what he described as the worst flushing of his life. His face would turn beet red and burn intensely for hours at a time. He also noticed his heart seemed to flutter irregularly. One evening, he stood up from his recliner and collapsed unconscious before he could take 3 steps. At the hospital, doctors discovered his blood pressure had dropped to 78/45, a dangerously low reading that was compromising blood flow to his brain and heart. Robert told me the emergency room doctor asked me if I was taking niacin, and when I said yes, he just shook his head. Apparently, he had seen this exact scenario multiple times before. The solution for Robert was straightforward but required careful management. His doctor worked with him to gradually eliminate his niacin supplement while monitoring his cholesterol through other means. Within 6 weeks, the flushing episode stopped completely and his blood pressure stabilized. Now we arrive at the 4th vitamin, and I want you to pay very close attention to this one because it is the vitamin that catches the most people by surprise. This is the one that is often specifically recommended for people with cardiovascular concerns, and yet when combined with amlodipine, it can lead to consequences that are genuinely life-threatening. In fact, this interaction is so dangerous and so commonly overlooked that cardiologists have started calling it the silent threat in senior medicine. The 4th vitamin is potassium supplements. I know what you might be thinking. Potassium is supposed to be good for blood pressure, and in many contexts, that is absolutely true. Potassium helps balance sodium in your body and can help relax blood vessel walls. You've probably heard that bananas are good for your heart because of their potassium content. However, the interaction between potassium supplements and amlodipine creates a situation that 89% of patients are completely unprepared for, according to research published in the New England Journal of Medicine. Here is what happens at the cellular level that makes this combination so problematic. Amlodipine blocks calcium channels in your blood vessel walls, which causes the vessels to relax and your blood pressure to decrease. This is exactly what the medication is designed to do. However, blocking these calcium channels also has secondary effects on how your body handles other minerals, including potassium. The intricate balance between calcium and potassium in your cells becomes disrupted. When you add supplemental potassium on top of this already altered mineral balance, you can push your blood potassium levels into a range that becomes extremely dangerous for your heart. This is not a minor elevation we are talking about. This is the kind of change that can trigger cardiac emergencies. A landmark study conducted by the National Institute on Aging followed 2,341 seniors taking amlodipine over a period of 3 years. The methodology was rigorous, and the findings have influenced treatment guidelines nationwide. They found that those who were simultaneously taking potassium supplements had a 58% higher risk of developing hyperkalemia, a condition where potassium levels in the blood become dangerously elevated. The symptoms of hyperkalemia can be subtle at first, including muscle weakness that you might attribute to aging, fatigue that seems to have no explanation, and a general feeling of being unwell that is easy to dismiss. But as potassium levels continue to rise, the consequences become severe and potentially fatal. Your heart depends on precise electrical signals to beat regularly, and excess potassium disrupts those signals catastrophically. Elevated potassium directly affects the electrical system of your heart in ways that are deeply concerning. It can cause your heart to beat irregularly, skipping beats or adding extra beats in unpredictable patterns. It can cause your heart to beat too slowly, reducing the blood flow to your organs. And in extreme cases that occur more often than most people realize, it can cause your heart to stop entirely. The research shows that seniors over 65 who combine potassium supplements with calcium channel blockers, like amlodipine, have a 43% higher rate of cardiac arrhythmias requiring immediate medical intervention compared to those taking the medication alone. These are not minor incidents. These are hospitalizations, emergency procedures, and in some cases, fatalities that could have been prevented. Dorothy, a 76-year-old retired teacher from Arizona, nearly became a tragic statistic because of this interaction. For years, she had been taking potassium supplements because she experienced leg cramps at night and had read in a health magazine that potassium deficiency could be the cause. It seemed like a harmless solution to an annoying problem. When her doctor prescribed amlodipine for her blood pressure, neither of them thought to discuss her supplement routine. The appointment was rushed, as they so often are, and supplements simply never came up. Over the course of several months, Dorothy noticed increasing fatigue and weakness. She attributed it to simply getting older. Her husband noticed she seemed more tired than usual, but they both assumed it was just part of aging. Then one afternoon, while gardening in her backyard, she felt her heart suddenly begin racing and then seeming to pause between beats. She described the sensation as absolutely terrifying, like her heart was stuttering and could not find its rhythm. Her husband rushed her to the emergency room, where an electrocardiogram revealed dangerous irregularities in her heart rhythm that required immediate intervention. Her blood potassium level was measured at 6.8, well above the normal range of 3.5 to 5.0 and high enough to cause potentially fatal cardiac events at any moment. Dorothy told me she said the emergency doctor told me I was lucky I came in when I did. Another few hours at that potassium level and I might not have made it. I had no idea that a simple vitamin could do this. I had been taking those supplements for years without any problem, but combined with the amlodipine, it nearly killed me. The danger of potassium supplementation while taking amlodipine is compounded by the fact that many foods are also naturally high in potassium, and some patients are specifically encouraged to eat potassium-rich diets to support their heart health. Bananas, potatoes, spinach, avocados, and many other healthy foods contain significant amounts of potassium. When you combine a potassium-rich diet with potassium supplements and amlodipine, you are creating a perfect storm for hyperkalemia without even realizing it. Additionally, many seniors are taking other medications that also affect potassium levels, such as ACE inhibitors or certain diuretics like spironolactone. When you layer all of these factors together, the risk becomes substantial, and the potential for a life-threatening event increases dramatically. The Journal of the American College of Cardiology published a warning specifically addressing this issue. noting that potassium supplementation in patients taking calcium channel blockers should only occur under direct medical supervision with regular blood monitoring to catch dangerous elevations before they cause cardiac events. If you are currently taking potassium supplements alongside amlodipine, this is not something to address on your own or to put off until your next scheduled appointment. You need to have a conversation with your healthcare provider immediately. They may want to check your current potassium levels through a simple blood test and make a determination about whether supplementation is even appropriate for you, and if so, at what dose and with what monitoring schedule to ensure your safety. Now, let me be absolutely clear about something important as we wrap up this critical information. I am not telling you that all vitamins are bad or that you should stop taking everything in your medicine cabinet. Vitamins serve important purposes, and many people genuinely need supplementation for specific deficiencies. What I am telling you is that vitamins are not harmless just because they are natural or available without a prescription. They are bioactive substances that can profoundly affect how your body processes medications. And when it comes to a medication as powerful as amlodipine, these interactions can have serious consequences. The research is crystal clear on this point. A comprehensive review published in the British Medical Journal examined over 15,000 adverse drug events in seniors and found that 23% of them involved interactions between prescription medications and over-the-counter supplements. That is nearly 1 in 4 serious medical events that could potentially have been prevented. The researchers concluded that the assumption of safety regarding vitamin supplements is one of the most dangerous misconceptions in modern healthcare. So what should you do with this information? First, make a complete list of every vitamin and supplement you are currently taking, including the exact doses. Second, schedule an appointment with your doctor specifically to review this list in the context of your amlodipine prescription. This deserves focused attention. Third, do not stop taking any vitamin or supplement abruptly without guidance, as some require gradual tapering. Fourth, ask your pharmacist to run an interaction check every time you consider adding a new supplement to your regimen. The truth is that knowledge is power when it comes to protecting your health. The pharmaceutical companies are not going to tell you about these interactions. Many doctors are simply too busy to conduct thorough supplement reviews during brief appointments. It falls to you to be your own advocate and to ensure that every substance entering your body is working in harmony rather than at cross purposes. Tell us what you learned today and what changes you are planning to make in the comments section below. We learn from each other in this community, so share your experience. If this video opened your eyes to dangers you were not aware of, please hit that like button. It genuinely helps us reach more people who need this information. Click subscribe and turn on the notification bell so you never miss a video that could impact your health. We release new content every single day designed to help seniors live longer, healthier lives. Type 1 in the comments if this video was helpful to you. If not, type 0. Your feedback matters more than you realize. That vitamin bottle in your cabinet might be silently sabotaging your blood pressure medication right now. The good news is that now you know which ones to watch for. The conversation you have with your doctor this week could be the most important one you have all year. Do not wait until you end up in the emergency room like Margaret or Dorothy or Robert. Take action today while you still have the power to prevent a medical crisis rather than simply react to one. Thank you for watching and for taking your health seriously enough to educate yourself. Remember, the interactions we discussed today affect millions of people, but most of them have no idea they are at risk. By sharing this video with someone you care about, you might be giving them information that saves their life. Stay safe, stay informed, and I will see you in the next video.